So most people think of HIV as a virus that only affects the immune system. But there's something many people don't know, and that is that HIV can enter the brain early on in the disease. And when it does, it causes serious damage, leading to something called HIV-associated dementia. Today, we're going to talk about what that means, how it affects the brain, and what can be done to manage it. So stick with me to the end because I've got some key takeaways for you. Welcome to my channel. So what is HIV-associated dementia? It's sometimes called AIDS Dementia Complex, and it happens when the HIV virus spreads to the brain and causes inflammation and damage. And this condition is also known as HIV encephalopathy. The more the virus spreads in the brain, the worse the dementia symptoms can become. So what causes it? What is the cause of it? HIV-associated dementia occurs when the virus attacks the brain cells, disrupting the brain's ability to function. That's what leads to symptoms like memory loss, poor coordination, and even changes in mood or behavior. So what are the signs and symptoms? The things to watch out for are trouble remembering things, if you're finding that you're struggling to remember things, difficulty concentrating, slurred or unclear speech, loss of interest in activities, no zest for life, and difficulty with coordination or movement. Sometimes you get mood swings or apathy, and in some cases, a swelling of the brain and spinal cord. But these symptoms might look like other conditions, so that's why it's important to get a proper diagnosis as soon as possible. So how is HIV dementia diagnosed? How do they diagnose it? So doctors will start with a full medical history and a neurological exam. And they might also use things like a mental status test to check your memory and your thinking skills. And they might also do MRI or CT scans to get images of the brain. They'll do blood tests and sometimes a spinal fluid test, which is called a lumbar puncture. And that, I think, is painful. Never had it, but I think it's painful. And these tests help rule out other causes and confirm if HIV is actually affecting the brain. So how do we treat it? Antiretroviral therapy is the treatment. It helps control the virus in the body and in the brain. And when it's started early, it can reduce or even reverse the symptoms. Other treatments can include medications like antidepressants or antipsychotics or stimulants. You might also get substance abuse counseling. Lifestyle changes are important, regular exercise, and use memory tools as well. Support at home, such as trained caregivers or therapists as well. Can it be prevented? Yes, if you are on antiretroviral therapy, your risk is much, much lower. And these medications help protect your immune system and your brain. So, some people might still develop milder symptoms, and that's known as HIV-associated neurocognitive disorder, or HAND. And living with HIV-associated dementia means being aware that it's a progressive condition. It's progressive, yeah. It doesn't get better. It can get worse over time. So support and planning are very important and essential. And the right care team and early intervention can make a big difference. So please get yourself checked out before it's too late. And if you or someone you care for starts having memory problems, trouble concentrating or speaking, mood changes, or unusual behaviors, get it checked as quickly as possible, because early diagnosis can lead to better treatment outcomes. So we'll wrap this up with some key takeaways. I mentioned it at the beginning. Key takeaways. HIV can spread to the brain and can cause dementia. Symptoms include memory loss, speech trouble, and motor decline. Antiretroviral treatment is essential and important. Supportive care and lifestyle changes can help, and early action gives you the best chance at maintaining your brain health. If this video helped you understand HIV and dementia better, please share it. You never know who might need this information. And don't forget to like, subscribe, and share for more videos on dementia care, brain health, and support strategies, especially in underserved communities. Remember to be kind.